This year we'll throw up almost close to about 115 crores of pathology work, which is all getting outsourced to multiple other providers. So that's an area that I believe can come into the AHH box.
You already have a play in mother and child, fertility, nephrology and urology as well. What are other specialities which you find exciting? I mean, something, let's say chronic, or what are other areas that you are actively looking at?
So if from our starting point, Vivek, so we have done oncology, we have done the women and child, we have done IVF and fertility, we have now done nephrology and urology. An area that is of great interest, which I believe again will do phenomenally well, is gastroenterology. Gut health is becoming a big issue, and also in terms of, as technology has increased and improved in that space, there's a lot of minimal access surgical work which is going on the GI side. So I believe that's an area that could come into a single specialty box. Of course, there's pathology diagnostics, which I find very interesting more and more at an AHH platform level, basically because we are throwing up so much of pathology within our enterprises itself. So, this year we'll throw up almost close to about 115 crores of pathology work, which is all getting outsourced to multiple other providers. So that's an area that I believe can come into the AHH box. Can neurology, neurosurgery come into an AHH box? The answer to that question is no. Basically because in that space, you need a lot of help from other specialties. Right? So you need a cardiologist, you need a gastroenterologist. Neurology, neurosurgery is a multi-specialty treatment model. And so which I believe can never really come out of the large format multi-specialty institution. There is obviously orthopedics, which has become single specialty again. So there are a couple of these specialties still in the ecosystem, which we believe are ripe to be in a single specialty environment.
Yeah, I think the other part about something like a neurology is that you will have to depend on referrals from these other
Correct.
players,
Correct.
whereas a mother child or IVF is
very consumer centric.
Yeah, it's consumer centric. You can build a brand, you can have a consumer playbook,
Yeah.
online acquisition.
Correct.
So that also probably makes the segment much more lucrative.
Yeah, because then there is a way for you to engage with the consumer.
Yeah.
Right, and because obviously the consumer is the one which is driving the decision making here, and so it gives you the opportunity of both working with clinicians on one side and also with impacting the consumer on the other side, and that's a good play, right? And in the single specialty work, I think a lot of that comes into focus because again, the personalization that you can give to consumers in the small format single specialty institutions is sometimes difficult on the multi-specialty side, and particularly as your boxes get larger and larger. It is that much more intense to do the personalization of services in large formats.